First of all, Professor Nolan, Dr. Glynn, I want to thank you for your efforts to date, which have been extraordinary in fighting this pandemic, and I know the people of this country are extremely grateful as well. I have 6 minutes, and that's to include answers as well. So, as much as I appreciate public health and epidemiology is complex and doesn't lend itself to brief answers, I'd appreciate it if you can be as brief as is possible. I'll be focusing on schools and education, which is, I think, one of the biggest issues that I suppose the public is concerned about at the minute. First question I have is, look, we have, in my view, an underfunded and overcrowded education system. An example of that is the grotesque sign of an isolation room in a national school in Athlone in a garden shed. I think I don't put the blame on the school. I put the blame on the Department of Education underfunding. I know you can't comment on that, but that's my view. My question is, though, because of the overcrowded schools' estates, social distancing is simply not possible in some schools due to a lack of space. That is the reality at this point in time. The implied message from the department seems to be to carry on regardless. That certainly seems to be what I'm picking up. So, Dr. Glynn, if a school cannot achieve social distancing, is it safe for it to reopen?
Thank you, Deputy. In short, the guidance around the need for social distancing and the differential need for social distancing by age group, those guidelines were produced a couple of months ago now. I can't speak obviously to individual educational institutions, but in short, we understand and internationally it's recognised that younger children social distancing is really impracticable, and so that should not preclude younger kids going back to school. We do expect, and we would hope from a public health perspective, that the vast majority of older children in national school, and certainly all children in secondary school, should be maintaining a distance of 1 metre from one another.
Thank you, Dr. Glynn. Secondly, I suppose I've been contacted by many school staff and parents regarding the difference between those at high risk and those at very high risk. Many school staff in particular have been very concerned. They've been certified by Medmark as fit to return to work as they're only high risk. They're upset and worried by this, and they feel compromised, to be honest. They're also unhappy at the relative lack of recourse. To be classified very high risk seems to be quite a high bar. On the other hand, as very high risk. On the other hand, the high risk category is quite broad, and it seems to take in fairly everything from mild asthma to I have cases of leukemia, people who have been certified as high risk and therefore obliged to work. So I want to ask you, should there be a more differential approach taken to high risk in the context of schools? Is it safe for all of those currently categorised at high risk to mix with dozens of people every day? And should the high risk bracket be expanded to encompass more students and teachers who are vulnerable?
What I would say to that, Deputy, is that regardless of what categorisation or bracket is there, each individual who has a concern needs to be treated as an individual with their own specific set of circumstances. If you go into any outpatients department in any hospital in this country and you have 40 people there for an ear, nose and throat clinic or a respiratory clinic, every single one of those patients will be treated individually and differently based on their individual set of circumstances. And I feel that really has to be the approach to either children or teachers or carers who have underlying health issues. It's not possible for me to proclaim overall, and really it's a matter between the individual and their GP and the occupational health service.
I think that's very useful, Dr. Glynn, because I do think it's an issue that requires a more tailored approach, to be honest, in my view, and from talking to school staff and children and their families, so I appreciate that. I think that's a useful insight. The final question I have is, you may have seen Minister Foley last night on primetime, and she outlined what happens in the instance of a symptomatic child, member of staff in the school. An awful lot of the answers pivoted on the GP will be informed, and after that it falls onto what she termed public health. But parents would prefer a much clearer idea. Now, I know that what you would provide would be a detailed answer, so perhaps if you can provide a written answer on who should isolate and what the considerations are, but to ask for just now a more direct and straight question. If a child gets a negative test result, is it safe for them to return to school immediately? And secondly, according to Dr. Mary Favier, if a child has the sniffles or is sneezing, and is otherwise well, they can attend. But coughing was not commented on, and obviously many children are asthmatic, have respiratory illnesses, and coughing will occur very frequently outside of COVID. In the instance of children who are frequently coughing, should they refrain from going to school? Should they isolate? These are the kind of questions. I actually think there's a need for greater publicity on some of these issues. These are the kind of questions that parents want answers to. Thank you very much.
So, Deputy, to answer briefly and quickly, if a child has a test and the test is negative, then based on the set of circumstances, that they should be able to return 48 hours after the end of symptoms. But it depends on the precise nature of the circumstances. So I don't want to. So I'll provide a written answer overall to that. In relation to coughing, Dr. Favier did comment at least in the press conference the other evening on that. So there will be children with an underlying cough as part of an underlying condition. It's a new onset of a cough. But again, on any given day over the next number of months, if a parent or a carer has a particular concern, they need to act with an abundance of caution in the first instance and keep their child at home. And if they have any concern, they should contact their GP. I know that will lead to very busy GP practices, but it is better to be sure and to be safe and to keep your child at home in the first instance, and to have clarity and confidence before you send them into school.